Oral submucous fibrosis, OSF, diagnosis and treatment. Oral submucous fibrosis, OSF, is a chronic condition that affects the oral cavity and sometimes the pharynx, causing stiffening and scarring of the mucous membranes. It is often associated with the use of betel nuts or tobacco products. Diagnosis of oral submucous fibrosis. The diagnosis of OSF is based on the following. 1. Clinical examination. Symptoms. Patients may complain of difficulty in opening their mouth, trismus, pain or burning sensation in the mouth, and changes in the texture of the oral mucosa. Signs. The mucosa may appear pale, fibrous, and leathery. There might be restricted mouth opening, trismus, due to fibrosis of the cheek and mouth tissues. 2. Medical history. The dentist or doctor will inquire about habits such as chewing betel nut or tobacco, which are major risk factors. 3. Biopsy. A small tissue sample may be taken for histopathological examination to confirm the diagnosis, checking for signs of fibrosis and inflammation. 4. Mouth opening measurement. The dentist will measure the interincisal distance between the upper and lower incisors when the mouth is opened, to assess the extent of trismus. Treatment of oral submucous fibrosis. The treatment depends on the stage of the disease, early versus advanced, and may involve both medical and surgical approaches. 1. Medical treatment. Steroids. Topical or systemic corticosteroids may be used to reduce inflammation and prevent further fibrosis. Vitamin C and B complex. These may help in improving mucosal health and healing. Intralesional injections. In some cases, injections of steroids or hyaluronidase, to break down the collagen fibers, may be used to reduce fibrosis. Mouthwashes. Antiseptic mouthwashes can be prescribed to prevent infections and maintain oral hygiene. 2. Surgical treatment. Mucosal surgery. If the fibrosis is extensive and limits mouth opening, surgical procedures, like split-thickness skin grafting or buccal mucosal excision, can be done to improve the oral function. Trismus management. In severe cases, surgical release of the fibrous bands may be required to restore mouth opening. 3. Physiotherapy, mouth exercises. Stretching exercises to improve mouth opening can be done after surgical intervention. Regular stretching of the affected tissue can also be part of conservative treatment. 4. Lifestyle modifications, discontinuation of betel nut, tobacco use. The most important aspect of managing OSF is the cessation of betel nut chewing or tobacco use, as these are the primary risk factors for the condition. Prognosis and follow-up. The prognosis depends on the stage at which the condition is diagnosed and treated. Early detection allows for better management and prevention of progression. Regular follow-ups are necessary to monitor the condition and to prevent complications such as oral cancer. If you or someone you know is at risk for OSF, early detection and discontinuation of risk habits are key to preventing severe outcomes. Would you like more information on prevention or any specific treatment options? 4.0 Mini